All right, thanks, Ashley. A new CDC study is shedding light on concussions among children under the age of 17. The study found that among reported cases, 7% of children have suffered a concussion or head injury. So as parents or grandparents, how can you tell if a bump to the head is something more serious? Joining us to explain is Dr. Michael Marchetti. He specializes in sports medicine with Hartford HealthCare Medical Group in Cheshire. Doctor, welcome.
Thanks for having me.
Great to have you. This is such an important topic. So what defines a concussion and how they can happen, especially among young children?
So a concussion, in the simplest terms, is when the soft brain hits against the hard skull. And we typically see these in sports, but it can certainly happen, falling off your bike, accident on the playground. And it's nothing that, it's basically just a quick change in direction. You don't even need direct trauma.
Interesting. All right. What are some of the symptoms that would indicate to a parent that their child may have a concussion?
There's a wide range of symptoms that are associated with concussions. In our older kids, we typically see difficulty with concentrating, problems with light or noise sensitivity, more emotional, difficulty sleeping, headaches, dizziness, nausea. And in our younger kids, it's a little bit more difficult because they can't always, tell us how they're feeling, or they don't necessarily know how they're feeling. So any action or behavior that is atypical of your kid, you should probably get evaluated.
All right. If someone has a concussion, what are the recommendations?
I always recommend everybody who has a suspected concussion get evaluated by somebody who's properly trained. At our high school and collegiate levels, that's typically an athletic trainer. They're normally the first line of people who evaluate, the athletes or the children. If not, I recommend, coming to see a sports medicine physician like myself.
And at what point should someone seek out a sports medicine physician?
I recommend anytime there is a suspected concussion, because there are certain things that we need to do as clinicians. We need to do a detailed neurologic exam, make sure there's no significant deficits. Normally going to the emergency room is not necessary. CAT scans are not very valuable in diagnosing concussions. But there's also protections that we want to make sure so kids' symptoms don't get worse when they're at school. And then, of course, making sure they're safe to get back to whatever sports or activities that they want to do.
All right, great information. Dr. Michael Marchetti, thank you for joining us.
Thanks for having me.